Go ahead, Mr. Sechrest.
All right, thank you, Mr. Beals. We do have a special committee meeting to deal with a financial issue to be voted on this evening. So this will be an official voting meeting here for this first item. So Ms. Maureen, if you want to do the roll call.
Here.
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 Here. And you want to try Mr. Barnett again?
Barnett.
Okay, Mr. President. I move to approve the resolution.
Second.
Yes.
Yes.
Mrs. Markle.
Yeah.
Schaefer.
Yes.
Yep, Mr. President, this is Mr. Black. I move to adjourn the special committee meeting.
Second.
Motion. Yes.
Yes. Yes.
And to the public out there, if it's helpful, you can raise your hand button on the bottom of your screen. If you click that hand, we'll then see that and we could make sure that you're not muted.
Okay.
I'm not seeing any hands raised, Mr. Sechrest.
Okay, I'm giving 30 more seconds. So have anything, please raise your hand. Okay, I believe we'll move on. First,
Sure. Mr. President, for the curriculum report, we have items A through D. Are there any questions concerning those items? Okay, hearing none, we'll move on to discussion items. We have item A, which is the health and safety plan. Any questions concerning that?
From the administration on this thing, or?
Yeah, so as you can see, the document that was shared with you, it should be visible also to the public right now. That's our, each district is required to complete a health and safety plan. Encouraged to use the PDE template, which this document does that. And it needs board approval before it's sent off to PDE. They don't approve it, but we just need to send it to them. So this document here that is on your screen is that document. So we definitely wanted to leave some time tonight for questions from the board, discussion. I can go through and give a brief summary if that would be helpful.
Why don't you do that, and then we'll do any questions that the
Great.
board might have at this point.
And Maureen will bring it up, although you're looking at your computer, but Maureen can also bring it up there. So the second page there of the document is the page that's going to, where we're going to note the type of reopening we're doing. Right now, we do not have that box checked yet because we're going to approve that on July 28th. And we decided just not to check that yet. So we're holding off on that. We do have the September 8th date down there as the potential start date, although that is something that is, again, not final yet because we have to vote on the calendar later on.
So, is this our decision to make, or is this the governor's decision on which category we're going to come back into?
It's our decision to make.
Okay.
Yep.
But it could be influenced by anything that the governor may do, correct?
Absolutely. The governor can come out and say, here's the option we're doing. But at this time, districts are allowed to choose one of these four options.
So since we're still at a low level here in York County, you have the ability to go back if you recommend it full reopening.
That is certainly within the spectrum of possibilities. Yeah, you see there's four choices there. Yeah, and we're basically holding out for as long as we can. Yeah, so, but we feel like we do need to make a decision at that July 28th meeting, just so people can then react to that. Because we're going to have some families that are going to say, well, I want to go to an online model because, or, you know, and participate in our NOLA, our Northern Online Academy. So yeah, we'll make that decision on the 28th and go from there.
But we're gearing up for all of those options right now. So we'll be ready for any of those.
Correct.
And then within the document, we have a pandemic team, a team that works to develop the plan and implement the plan. So that's what you see on that page. We have our community physician, we have representatives from band, athletics, administration, and that's just some of the names. We had a larger group of stakeholders get together and meet to discuss these things. And then it goes into the various domains. The first one is the facilities cleaning and sanitization domain. That requirement there within the document is something we have to do if there's an asterisk by it. And this is the way we're going to address that requirement. The second domain is the social distancing domain. Again, it's an asterisk requirement within the PDE document. Therefore, it is something we must do. And to the right there are the steps that we plan to implement in order to make that requirement possible. There's also an asterisk requirement for restricting the use of cafeteria in congregate settings. We had much discussion on the definition of restrict in our stakeholder meetings. Some felt it meant no Some felt it should mean restrict but not close, so on and so forth. So we had some good dialogue back and forth on that topic there. There's a hygiene section there with an asterisk in terms of washing of hands. There's a posting of signs that's asterisk, meaning we must do that. So we've sent signs out for those categories to every building to be posted. We've had our athletic health and safety plan board approved last month. There's some other suggested or recommended sections within the template that do not have an asterisk. That is how we plan on doing those. The next domain is monitoring student and staff health. Yes, you're required to monitor student and staff for symptoms, whether that's self-screening, whether that's monitoring at the door, whether it's a combination. As of now, with our extracurriculars, we are having the students fill out a self-screening wellness tool. Mr. Schwuley reports that's going really well. That's how we're currently doing the extracurricular piece.
Are they talking about taking tests at all?
We are talking about that. And what we found with other districts is there's a mix really of to the extent some are checking staff temperatures, some are checking student temperatures, some are doing both, and some are doing neither. Right now, there's not a lot of reliability on a fever itself as a symptom. In fact, a lot of students can have or staff can have it and not have a fever. So it's not a real good measure. So we're leaning more towards the self-check, the self-temperature check, working with parents to make sure that they keep their children home if there's any signs of any symptoms that could be COVID related, and the same thing with our staff, self-check.
And then further on in the agenda, you'll see there's a pretty detailed document that Ms. Unti has put together for the return to work and school guidelines. So we do have a plan in place for that. The last section in this document would be just other considerations. This gets into high risk. This gets into face coverings. And that's the final domain within the document. And then the last part of the PDE template asks for what kind of professional development do you plan on providing your community, your staff, your students? So we have those lists there in terms of appropriate face covering, wearing and removal, hand washing, self-monitoring. Our elementary teachers are doing receiving some instruction from the nurses in terms of food allergies in the event that we feed elementary in the classroom. So we want to make sure that we've taken care of that. Cleaning schedules, and then the communication plan. How frequently will we be communicating with whom and by whom? And so that's a real quick summary of an 11-page document that it's a high level. This is a high level plan. It doesn't get into the weeds very much. And it's a flexible plan that we will need to come back and adjust as the months unfold here. So, go ahead, Steve.
Well, just within this framework, then we're going to continue to fill in those details, and that's some of the feedback. And you had asked earlier what kind of feedback we're getting. The thought exchange with the community is still underway, and goes till Thursday. But we have some preliminary feedback from them, and basically they're asking for details. You know, we looked at some of the higher rated comments, and they're talking about wanting to know more about quarantining, online instruction, student support and engagement, the closure plan, masks, air quality, all the things that are just where we need to fill in with details. So, and that's the goal right now. We're gonna spend our energies now filling in those details. Mm-hmm.
And I think you'll find that the community document that went out even had a lot more detail than this document. So those that I'm sure you received the community document that we had sent out. That even went into more detail for each level.
And then finally, I just thanks to Matt, Mr. Labuda, because he did a lot of work coordinating and compiling this report. A lot of people coming at him from different directions about all these issues. So thank you, Mr. Labuda.
Thanks, Mr. Kirkpatrick.
Okay. Questions, comments? First of all, I'll just echo that. I mean, this is very well done, in my opinion. A lot of work, it looks like, went into this, so thank you for that. Yeah, comments?
I had a couple. Page 4.
Yes, sir.
So, it's just because
I've spent the last,
so,
obviously, we don't have time done.
along that board, but I've spent a considerable amount of time from
Our professional
daily jobs looking at HVAC systems,
recommendations on coming back to the building.
ways to mitigate the infectious disease. And I know you have it here, and I know there are different places where they talk about increased outdoor ventilation, but if you open windows on a day like today, when the HVAC systems can't overcome that additional load, you actually cause more damage than you do good. So I would just caution you, and I'm sure whether Matt's already talked to John or talked to NRG or controls companies about how to sequence HVAC equipment. You can ventilate, you can run the units occupied 24/7 to bring in additional ventilation, rather than opening up all the windows during a day that you're not designed for. So I would just caution you to do that. And
For number
3, did you say possibly convert shared drinking fountains to new bottle filters? I know what they are. Do you really plan on doing that in the buildings? Yeah, okay. And I was gonna say, because if you do, that's fine. If you don't, and this is in the document, I think there's gonna be an expectation that you do.
We already have one in Wellville. They're already there. That was done as part of that renovation. We're definitely doing it at secondary level. We're likely gonna have one at least one of those in every building. Specifically, I know talking with Mr. Shellot, there's required food service side of things to provide water. Instead of having tons of bottled water that we would have to provide them, buying one of those out close to or near the cafeteria. We're using the cafeteria, but in that general vicinity, provide that water to the students. Yes, we're likely to have one program.
Okay.
Every student has a sports bottle, so.
Right.
So much.
And we have possibly convert shared drinking fountain into bottle fillers. So, but the plan is to do it. When we met with our school physician, she also, expressed the importance of providing water. And if we're shutting the fountains off, which is a very strong recommendation, so kids aren't using the fountains like kids sometimes use, we need another water source for them. So yes, bring your own, absolutely. But the cost to provide bottled water every day for 3,750 people, 180 days, would just, I think the bottle fillers would be much, much, much cheaper. So we're really looking hard at that and hope to have that, but we do have possibly in that document. Greg, yes, the HVAC, the original one had doors and windows open. Doors are no longer in there. It's funny how, not funny, but back in 2018, we were talking about not only locking doors and closing them, but putting secondary locking mechanisms on all doors after some of the incidents that had occurred in schools. And now here we are 18 months later saying open your windows and doors. So we've definitely had some vigorous conversations about that. Matt has told us that you do not want to open up windows, and I don't believe some of them can be anyway, but because of it wreaks havoc on the HVAC system. So yes, absolutely, it's in there as a possibility, but I appreciate that. You guys, know more about that than I do, so thank you.
We have, obviously, we have architects, we have engineering partners, we have other partners. They're all going through this as part of their jobs, and so there are some pretty easy ways to meet a lot of the requirements or a lot of the recommendations without incurring a lot of additional costs.
Thanks for your feedback on
I
that.
agree with Greg on that. I've had insight into that, and there's been very little change that suggests that additional ventilation has anything to do with the building. For other reasons, it's good, but it's not an airborne.
It's not an airborne.
There's zero sense in changing it's not going to impact what your filtration system and surfaces.
So the item 4 on there, the microfiber cleaning, Jason,
That was we talked about it a couple months ago, or not was implementing that.
Yeah, so we're gonna, he was only gonna do it at the secondary level or at the elementary level.
Elementary level, yeah.
Yeah, so we're actually looking to just do it district-wide now. And some of these things, and we can get into this, I don't want to get ahead of things, but we're getting grant money for a lot of these types of things. So the bottle fillers, those parts, and that's all gonna be funded through, the grants that we're getting through both the state and the federal government. So, we'll get into that.
Yeah, right. Okay. But those are all sensible things. There's a lot of nonsense. So. Okay.
Anything else?
Okay. And moving on to the next discussion item is the Northern York County School District Employee Response Protocol to COVID-19. Matt, did you have anything you'd like to share with that?
Andy's actually going to briefly summarize.
I'll just jump in here. I will offer, before we go into executive session, one more public comment period, okay? I'd rather we not interrupt the meeting as is with comments from the public. We'll do that at the end of the meeting again if things come up that folks want to address, because we certainly want to hear from the folks, okay? Sorry, Andy.
So this employee response protocol, it basically centers around the CDC recommendations and around the three main pillars of that CDC recommendation, which is a confirmed case, a suspected case, and an exposed case. So this actually out for us, our so, our employees eligible for what how to handle contact tracing, how to handle also how long so we I just to college person I have every starting point for us. Outline.
Are we in any way involved? Are we
Ourselves.
testing ourselves or
Nurses
or
by.
healthcare?
It is completely handled by healthcare providers. Yeah. Not involved in the testing at all. And the testing has fluctuated a great deal. So, you know, when this first started, we were seeing testing home for 5.
like I'm supposed to hear this and understand it.
Angie, I apologize as far as those who are off work, as far as the compensation. How, you just want to elaborate on that, what we're going to do? I saw it in here somewhere and you think I can find it.
So again, that's only for someone who their childcare or their school has closed for COVID-related reasons. Okay, and I'm going to be doing a informational session on Thursday with our staff. We've had a number of staff approach us. We've requested that they contact us if they have any concerns or want more information about leave options. So Christina Esser, our benefits coordinator, and myself will be doing a brief informational review for them, just to help them kind of interpret all of it, because it is a lot of information, can be very confusing. So.
You had mentioned about people having to self-quarantine if they've traveled certain areas. I mean, what are we going to do as far as trying to get these folks to try to avoid that type of activity, you know, during the school year? I mean,
Yeah, that's a great question.
I would encourage that we do something
Yeah.
along those lines to try to.
Yeah, I mean, I would share that a lot of the people who have reached out to me have they planned these trips long ago and they're non-refundable.
Right.
And it's their family's one, opportunity, and they're
Yeah.
taking, definitely taking measures while they're there to be smart, wear their face covering, not be out in crowds and that sort of thing. Yeah.
Ken, I don't know if you're asking about students in particular, but Vanjie did send an email to staff.
Okay,
giving them the heads
I
up.
was thinking
Then
more
that
along the
went out to
lines of
staff.
staff, but
Yeah.
students as well. I
Yeah.
mean, certainly, whatever we can do to lower our risk
Mm-hmm.
would be good.
Mhm.
But again, I mean, people can do what they want.
Yeah.
But a little education doesn't hurt. Okay.
So that's our responsibility.
As the employer to
File
for the reimbursement of benefits, the federal act.
Yes, I believe that is handled through a tax. Jason, help me out here. Is that handled through a tax reimbursement or a credit?
I was just saying,
The
it's
FFCRA?
inevitable, we're gonna have somebody test positive.
I'm sorry, guys, just a reminder to unmute when you're, I know you are, Greg, but just make sure we unmute. Sorry, Greg. go ahead.
No, that's okay.
But I mean, it's inevitable. We're probably gonna have 4 members test positive. We're going to have one, at least one staff, at least one student. So I just want to make sure, like procedurally, so they're eligible for 2 weeks because they're going to be 2 weeks off. So that's something that we apply for reimbursement through.
Eric,
What's that? There's like a CRA reimbursement.
Correct?
Not for us.
It's like, not for us, for the employees.
No, we're paying them while they're on leave.
Okay,
So we're not taking advantage of the money that's available to be prepared.
We're not out.
Not.
So this is all additional expense against the budget.
But when they're I mean,
Yeah.
it's frankly, it's 10 days, 6 days.
Yeah.
They can actually- So I don't necessarily do it that way, but yes, yes. But for those that can telework, I mean, for summer months, I mean, as Vandy stated, we have several people that, because of travel or whatever the case may be, they're making other arrangements in order to continue working, even though they're essentially using some days or using some hours because they can't. So we're trying to work with Vandy specifically, work with people to try and make this work out, at least over the summer. Once we get to the fall.
Anything else?
Okay, our last item is the 2020-2021 calendar. Are approved in our alternate calendar.
Okay. I can speak. I can speak to that if you'd like. Okay. We do have two calendars. There's the original calendar that was approved by the board, and then we brought forward a second calendar to the board for consideration, an alternate calendar, which you also approved, tentative on making a decision on one of these calendars officially on July 28th. The administration would recommend to the board that we go with the alternate calendar, the calendar whose first day is September 8th, which is the Tuesday after Labor Day, and whose last day is June 8th. It is, from the administration's view, the more efficient of the two, and also going to be better for everybody in the long run. It buys us more time to train our staff. We're going to, this calendar front loads 7 in-service days that would otherwise, a couple of those would be spread out through the year. And we're going to need every minute of those days to provide training for asynchronous instruction, for best practices for the software we're going to use. We're going to need that for to prioritize the curriculum. In the event we would go remote learning and have to prioritize what is taught. And we have to also provide the health and safety training to our staff that was highlighted in the health and safety plan. So we would like to have that opportunity to have those 7 days up front. It also allows us to finalize our implementation of our health and safety measures and our instructional plan. And then it's not going to be a bad thing either to see how things unfold. Some other school districts will have started earlier, and the fall, a couple of weeks will have passed by as well. So again, time is our friend in that regard. So we'd like to buy the time that we can by starting September 8th.
Yeah, everybody I've talked to in the community that has kids said that's a smart thing to do, so. So, quick question, so when we sign off on the health and safety plan, do we have to indicate at that time which type of reopening we're doing? So we have to indicate next
Yes.
Tuesday what our plan is. Okay. We can't wait till.
But it's a living, breathing document,
You can
right?
change
It's
it.
dynamic.
You can change anytime we want.
We'd have to bring it back to the board to change it.
Yep.
But
Okay.
But we'll have a box checked on the 28th.
So it could change monthly. Okay.
That's it for curriculum. Thank you.
Buildings and grounds, Mr. Rudy.
Yes, we have
Facility use request.
Get the combo.
If I had a question before others chime in on just the first one there is in August. On an outside group like that, are we requiring anything of all their participants to sign similar, right? Like all our students that are participating right now are like doing daily checks and those sorts of things. Do we have any obligation or need to require that of the football and cheerleading group? Or
Yeah. Yeah, so no, every group that's using our facilities is required to have their own policies in place, and Jerry Schwerley, our athletic director, is monitoring that and making sure they have them. He's reviewing them. So yes, anybody that's here, an outside organization that's here, has to have some sort of plan in place in order to use our facilities. So yes, that is in place. And also with this specifically, so the youth football has been canceled. So they're just going to be doing things kind of in-house amongst themselves, do a scrimmage amongst, split up their team or whatnot and just play each other type of thing. But they want to continue to try to provide some things during the summer months. So that's what's going on.
They're looking at doing a 4-week camp. And there are guidelines that are being pushed by the football, the Northern New York football team down to the NYFC because they're going to be involved in kind of mentoring it. So there are guidelines that are being put in place, especially related to COVID, including wearing masks on the field, sidelines, et cetera. So, and if NYFC chooses not to adhere to that, then the Northern New York football would no longer be involved in it. At least that's the first communications I read. I'm actually coaching in that league, so I have some information on it, but I think it's still developing a little bit.
Do we have any concerns with concession stands?
You're asking to use the facilities, so give them the guidelines and they kind of have to follow them. Or
That's my question. I mean, what's the experts say on that?
And so
What does our medical experts that we have in-house, our nurses, et cetera, who have been a part of all of this, would they have an opinion on the concession part of it, I guess?
So what we've been doing, so for the athletic health and safety plan from last month, since that dealt with the summer workouts, that did not deal with the competition part, concession stands weren't in there. But with that being said, we've discussed that, and we're meeting Thursday to update our athletic health and safety plan, because that only goes to August 10th. And we need to have something going forward, should fall sports be occurring. The concession stand, what we've been using is the business and industry food CDC guidelines in terms of if we're going to use the concession stands, we plan on looking over that, prepackaged food, whatever that is. I haven't heard that people have been told that they won't be able to use the concession stands. That may have been said, but I don't know that we made that decision yet. Just so you know, that may be the case once we meet and finalize the plan. But at this point, we haven't crossed that bridge yet, but didn't think about it for the youth football. Good question.
like stuff. We're going to do model walks, where it's not that expensive. Pre-packed stuff. There's just a lot of
there's ways to do, yeah.
Yeah, ways to do it safe.
I think just to back what Jamie's saying, whatever the decision, just make sure it's consistent through all of them so that.
Et cetera, as far as what we're doing, as far as getting them up, et cetera. So
That's on our Thursday agenda also. Transportation, competition, interleague play, our fall sports we have field hockey, tennis, cross country, golf, football, so on and so forth. So we're going to plan on, since we haven't heard the fall season is canceled yet, we're going to move forward with plans to operate and abide by social distancing and cleaning and disinfecting guidelines as best we can. And then when we get that plan done and to you, we'll get word on whether or not the season is going on. But
All right.
Nothing else, sir?
Is there any William Wells update?
We finally have our hearing in front of the judge on Monday at 1:30. It's now virtual. So we'll be virtually, hopefully, approving the sale of William Wells.
All right. Excellent. That's it. Thank you. All right. Budget and Finance, Mr. Halatke.
Okay, trust. Letter A is approved payment of bills from multiple funds.
Checks. I looked at one of them.
Okay, if not, letter B, approved treasurer's report. I don't know, John, do you want to comment on?
Yeah, I would like to speak. I would like to speak to the June 30 budget status report, give you an update as to where we're at. So I'll talk about kind of what's on the report and then some good news I'll say for the ending. It's not on the report. But you see things tightened a little bit in revenues if you compare the previous budget statuses to this one. Tightened a little bit in revenues. But the good part here is in the expenditures. So you'll see if you go down towards the bottom in terms of total expenditures, we're about just shy of $600,000 under budget, which is just over 1%. So this doesn't include some of the accruals and things for year end. I did try to encompass some of that on this report, so that's certainly not the ending expenditure number, but hopefully it's relatively close to where we're going to end up. I didn't have a chance to really go back and kind of look at the budget, the actual report to say, okay, where were the places that we really were able to save in terms of the buildings being closed down for 3 months. Certainly there's going to be utility usage that was dramatically lower, but what does that equate to in terms of saved dollars? I haven't had a chance to do all that analysis. So I will be bringing that back to the board, hopefully in August, to try and kind of break down a little bit of those expenditure differences. But good news is that, we have had savings there of about $600,000 under budget. So with that, you'll see the deficit of just over $1 million. Again, that's the operating deficit when we take out the bond funds that we're going to get previous year costs. The actual deficit's about $781,000. But again, I want to focus on that $1 million operating cost, because that's really where we look to be at from an operations standpoint. The other piece of good news that isn't on here has to do with EIT taxes. So we got our July payment the end of last week, and it was actually surprisingly a lot higher than I had anticipated given the shutdown. So our July payment is historically about a month of May, some of June's payroll, as well as reconciliations for the second quarter. So April, May, June. So the months that we were really shut down. Surprisingly, our July distribution was over $500,000. It's about what it was last year. So we really didn't see any sort of decrease in that EIT distribution in July into June. As I said, about $100,000 lower in June, but July came in really strong. So that's not reported in this budget status report because this was prepared before I had those numbers. So it looks like EIT is going to be really close to budget, which 3 months ago, that was definitely not what we've been hearing from both Mark Adams and really from everybody, that we're going to get nailed pretty hard with with a reduction in our EIT taxes. So we've got lucky for July. That's 1 month. We'll have to wait and see what August brings. August revenues still get reported in this fiscal year, the June 30, 2020 fiscal year, because it's revenue that would have been for basically the June payroll. So we'll see how that comes out. But the good news is that EIT was definitely a lot stronger in July. So that probably will add about $100,000 to $150,000 to the revenue that you're seeing here. So I'm showing a year-end variance of $440,000 being under revenue. When you add that in, it might be closer to about $300,000 being under revenue. The other piece that's not included on here is, so we started receiving some of our COVID grant funding through the CARES money. And the state allocated their first portion for costs from March 13th through October 31st. So we certainly had some costs in March, April, May, June that were for COVID-related items. So we're going to be putting together a grant reimbursement form that will be shown as revenue, as a receivable, because it was costs that were pre-June 30. So again, that's revenue that's not on this report either. I'm not really sure what that's going to look like. I'm guessing it won't get to $100,000, but it'll probably be at least $50,000. So again, a couple of revenue items that you're not seeing here that are going to help that bottom line. Basically, making that about $1 million loss, maybe about an $800,000 loss. So if you remember, the budgeted loss was $1.2 million. So I'm hoping we see ourselves $300,000 to $400,000 under that budgeted deficit. So a lot more to come. There's a lot of moving parts right now. These grants just came out. We're still trying to figure out what we're going to put towards those grants. What are those costs actually occurred before June 30 and what are now occurring after July 1? So just a lot of timing and a lot of different pots kind of on the stove right now, trying to figure out where those costs are going. So for the most part, as of June 30, I think you're going to see final revenue numbers being higher than what you see here. I know you're going to see them be higher than what you see here. Expenditures hopefully are going to be about the same. So in a nutshell, I know that was a lot of information. I think that the biggest thing going forward is I'd like to break down kind of the expenditures, as I said before, why we saw some differences in our expenditures and the reasons behind that. And also I want to give the board kind of an update in terms of these different pots of grant money, where we're looking to spend those items and how much we're getting, because it is a substantial amount of money through the CARES grants, CARES funding that we will be receiving. Unfortunately, some of it is clear as mud right now. Specifically, the piece that's coming directly from the federal government is very, very dirty. It's hard to tell exactly what we can spend it on and how we can spend it. Fortunately, the state side of things that we got for March 13th through August 31st, that's much clearer. We have a budget for that, kind of know what we're going to spend most of that money on. But I'd like to, I'll be breaking that out for the board here in the next month or so you can have an idea as to what kind of grant monies we're going to get. None of which are in last year's budget or current year budget. So some good news from a finance standpoint. Feel like the last 6 months I've been very negative, very doom and gloomy. So it feels good to sit here and give you some positive information for a change.
So those COVID-19
expenses are already included.
Correct. For the most part, yes. Yep.
Thomas Donor, the tennis courts I see.
Yep.
The lights in Boston are
Yeah, so the tennis courts were done. We submitted to the foundation for the reimbursement. So that money actually went to the foundation. We did the project and the foundation will reimburse us the cost of that project. So that's in process now, that invoice to them. The lights, I just talked to Mr. Johnson yesterday about the lights. They're scheduled. They said it's about a 4 to 5 week window that it'll take to actually do that project. He's hoping they can start at the end of this month, so hopefully in the next week or so, as long as things are on schedule, to be hopefully completed by about the end of the goal right now. So yeah, those things are still ongoing. We have some patchwork out in the asphalt area of the high school that we needed to have done as part of capital, smaller, obviously. So yeah, I think things are moving forward with the capital.
Are they still doing the stage?
So we actually reached out to Lobar Associates through a state contract. We've struggled to get contractors that are willing to do the work and come and be responsive to our needs right now, believe it or not. So we actually did reach out to Lobar. They were on top of the program. They're finalizing that as we speak. Hoping we may even get this week. As soon as we do, we're ready to roll on it. So I'm still hopeful that gets done before school starts.
And that's to CoStar or some other program.
Yeah, the tennis courts look great. Nice article in the banner. I thought, I don't know where that came from, but it's nice to reward good things. You know, we had a very generous donor put that out. We never would have thought that we could do something like that. So it looks tremendous.
Okay, any other questions on the treasurer's report?
Okay, letter C, report of various accounts. It's interesting, you say that every month, and this is, I don't know if that got prompted or this is the first time I've actually seen the student activity account summary, but so there is a student activity report summary there. And then D&E or tax exonerations and tax exemptions. And then finally, letter F is reimbursements paid to Craig Robach for engineering costs for your project.
Hey, if there are no more questions, that's it, Mr. President.
Okay. Anything else? Okay. Athletics and activities, Mr. Barnett, you have nothing there. Policy committee, Mrs. Schaefer.
We have 6 policies for final approval on the agenda.
There were no changes to any of these policies from the tentative version that you saw last month. So they are as they were first time through. Most of the changes that occurred in these policies dealt with a new definition of tobacco that was given, that we had to work electronic cigarettes into our definitions, and there were a few other small changes. We also added the emergency declaration section to the attendance at meetings via electronic communication policy, so that if anything were to spike up again, the board members wouldn't have to request to be able to participate virtually. We can just do it now. It's in the policies.
Thank you, Matt.
Okay, any questions? Okay. Transportation, Mrs. Markle.
There are no action items. It's a discussion item. Early childhood centers. I hope somebody has something because I wasn't given anything.
Again, Mr. Beals may want to comment as well. So we heard from, Mr. Beals heard from,
I'm unmuted now, I apologize. We heard from a few of our daycare providers. They reached out to Mr. Beals and requested that we take a look at transportation for daycares that are not within the elementary attendance area. So for those that have been on the board for a little while and for those that are newer, several years ago, we discontinued providing transportation from a daycare provider to an elementary school that wasn't within that provider's footprint. So for the most part, most of our daycares are in the Dillsburg Elementary School footprint. Years ago, we would have transportation from those centers to other elementary schools, South Mountain, to Northern. We discontinued that several years ago. Now they are required to provide transportation to our other elementary schools. They came to us, they talked to Mr. Beals about potentially taking a look at that, revisiting that this year under the economic circumstances that they're in. Certainly their numbers have to be smaller in terms of what they're allowed to have in their facilities due to their requirements and things. So they reached out wondering we would do a 1-year reprieve of that policy and pay for somehow at least try and get those students on our buses and transport them to the other elementary schools. Mr. Beals, I don't know if you'd like to, I don't want to speak on your behalf. I'm going to chime in on that discussion.
Yeah, I'll certainly try. As I shared with Steve and Matt, my connection's very poor on vacation. But as Jason said, that's exactly the case of what occurred as we were talking with the early childhood. And the principal issue they're facing is 50% enrollment on a revenue side. It costs them about $3,200 a month at just one of our providers to have that service through Roar. And they're indicating that that's a cost they cannot assume based on the fact that their enrollment has been so negatively impacted by COVID. And so the request was, would we give that reprieve, as Jason said, and provide the transportation to their facilities. Primarily, South Mountain is the most significantly impacted. There is currently no operating commercial entity within their footprint. And so transporting from South Mountain to others providers is about 50 total students right now. And again, they're having a hard time knowing what their enrollment would be for the fall because they're waiting to hear what's going to happen with COVID and our final decisions with remote versus online versus face-to-face and so on and so forth. So they're in a bit of a pickle and they've asked us to transport children to their facilities.
Jason, is this something that could possibly qualify for CARES money or not?
Potentially, I think it probably could. So before we go there, let me take a step back because things have changed over the last 24 hours as well after Jason has had discussion. We actually have a provider that has started services at Dillsburg Elementary School. It's the Mechanicsburg Learning Center. I'll say MLC for short, but their name is the Mechanicsburg Learning Center. We have an agreement with them. When we originally began that agreement, it was to try and do both Dillsburg and South Mountain, to have them have a site for those locations. Unfortunately, the enrollment at South Mountain never was high enough for them to have a full-blown daycare at South Mountain. They only had a few kids that registered for various reasons. With this going on and knowing that one of the daycare providers that houses some students at one of the churches in South Mountain, they're looking at potentially not doing that this year. We reached back out to the MLC. Dave Eckelmeyer and myself had a meeting with them yesterday morning to see if they would be interested in revisiting the discussion and housing students or providing that service at South Mountain. It was an adamant yes that they would be. I think it makes sense given the delayed start to have those students actually in the building. It probably makes more sense for some of the parents. And they are 100% willing to open that up at South Mountain. So that, is a new twist, I guess, in all of this. We're moving forward with trying to get that started over there. The plan is to at least shoot something out to the community so that it's going to be available, and we'll have to see where enrollment goes with that. Certainly, if they only get one student, I'm not sure they're going to want to have staff on site for 1 or 2 students. But if they can get 10, they certainly will be housing a facility there. So with that, I think, we need to decide, what we're willing to do or what not to do. And I don't think we necessarily need a decision here today. But through the discussions that Mr. Beals had last week, we want to know if the board is open to looking at transportation and providing transportation basically outside of our current policy for students that are in daycare providers, for the most part in the Dillsburg attendance area, providing transportation to another elementary school that's not Dillsburg. So if the the board says, nope, we're going to stick to our guns and stay with our policy, then we know that. If you're open to us, having these discussions, seeing what kind of enrollment the MLC has, and kind of seeing where that goes, I think we're open to that too. But it's a lot of unknowns, unfortunately. We won't have answers about enrollment. Even the daycares right now don't have answers about what their enrollment's going to look like. So, I think they're testing the waters to see what they can do. And, we'd like to provide them an answer, but again, I don't think it's a yes or no or black and white answer.
Are there facilities in Wellsville?
Yes.
Okay, that's changed. Good. Do
Yeah,
you
I'm sure.
have,
Jason, there is not a functioning facility in Wellsville.
I know where you're.
They have students there.
Yeah, because we faced that 16 years ago, and the board generously allowed our kid to go to Filey's, and it was a godsend. It really was. Do you have a ballpark figure what that cost could be?
For transportation?
Yeah, if we were to say, yes, we can do this. I know it's a lot
Yeah,
of
it depends on how we do it. I mean, if we wanted to do it, I would certainly try to piggyback on our current existing runs. I wouldn't just say, yeah, we'll take your existing run and pay for that run. I would try to meld those students into some of our existing runs, which would mean likely that they would come from their home or from the daycare to Dillsburg, and then from Dillsburg to South Mountain is likely what that would look like. And potentially they would be slightly late getting to South Mountain because, but I think from a cost standpoint, that's going to be the most advantageous for us.
Okay.
Mr.
Without
Beal,
knowing the moment, I don't.
Yeah.
Mr. Beals, I don't know if you were aware though, so if there's a potential MLC at both SMES and DES, were there any things you wanted to add to the conversation maybe?
Yeah, it helps with South Mountain. It does not solve their request. They were still both, three of the facilities had more than 8 students at Northern Elementary School each. So this will continue to be an issue, but the MLC will help certainly for South Mountain and the families in that attendance area.
Thank you.
Yep. And to Ken, your comment about Wellsville attendance area, at this point in time, there is not a functioning option for Wellsville families in the Wellsville attendance area. That facility and the Head Start facility have not been functioning for about 6 months now.
Okay. Stepped up our game out there in the middle of nowhere.
So I have 2 questions, and the first is if the MLC is going to run those centers, their first day of school for us, or they have to start before that?
No, they typically will call around.
Okay. And the same thing, if we added additional busing for Little Dreams or some of the other ones that are asking for that locally, that's the same thing. Busing can start on September 8th and then only occur.
And at some point, if we go to
Whatever model or whatever, I mean, that could
change. The rest of the hybrids all so very fluid.
I mean, I think if the board's open to us, at least working with them and seeing what we can do, we'll, I guess that's just the guidance that Mr. Beals and I were looking for, that, board would potentially be open to looking at something like that, depending upon what kind of enrollment the MLC has at South Mountain, the enrollment at Northern, and again, a lot of unknowns, but the board's open to us trying to work with them, try to do that.
Anyone have any issue with that? No, I mean, what our parents are going to be going through and what they've gone through recently. I mean, we can make it work. However, that.
Okay,
thank you.
Yep. Thank you.
Good.
okay.
And we will just do a quick comment before we break into executive session. Again, I would ask anyone that has anything to come before the board from the public, please give your name, address for the record.
Citizens' comments or questions are welcome, but we would ask you to limit to 5 minutes. Questions and comments concerning individual staff members, students, or your own children's problems will not be addressed at a public meeting. However, your comments will be given consideration by the board. The board may choose to not provide a response on your issue this evening. So, anyone have anything they'd like to comment?
If you could please, once again, click the raise your hand button on your screen so that I could be sure that you're not muted. And I also wanted to just quickly explain, we didn't explain in the beginning, we were having some technical difficulties. If you see anybody here tonight that does not have a mask on, they are more than 7 to 8 feet apart from one another. Those of us that are clumped a little closer together here, we have the mask on. So if you're wondering why some do and some don't, our board members are all socially distanced at least 7 to 8 feet apart. Okay, guest, AMS guest, did you have a question? How about Ashley? Ashley, did you have a question for the board or a comment, I should say? If you happen to be speaking, Ashley, you might be muted. The hand is down now, so I'm not sure if it was an accidental hand raise.
Okay.
I'm not seeing any other hands at this point.
Okay. Will Alyssa have access to the executive session?
She did get a link, so I'm thinking she should.
Was that the complete link?
Can you hear me?
An executive and
It was a
regular?
separate link.
Okay. All right. Very good.
Alyssa's in now. So
Yeah, can you hear me?
yes, Alyssa, we can hear
Okay,
you.
yeah, I do have the link, so I will come on the executive session, but my Wi-Fi is pretty spotty.
I didn't hear that.
Hi, wait, I'm sorry, my mic, it wouldn't let me unmute it. Can I ask my question or is it okay?
Yes, hi. Is this Ashley? If
Yeah.
you have a comment for the board, go ahead.
Yeah, I was just wondering with the Mechanicsburg Learning Center, when I was going to make a decision with that. I currently have my son enrolled into Little Dreams for South Mountain Elementary, and I'm just worried if I need to change that and find something like if the Mechanicsburg Learning Center is available, if I should just be doing that. And
Yeah, Mr. Eckelmeyer and the Mechanicsburg Learning Center is going to be working on getting that information out as soon as they can. We like I said, we met with them yesterday. We talked about getting communication out to the parents as soon as possible. So you should be seeing something relatively soon in regards to the MLC at South Mountain.
okay, just as a heads up, the new incoming kindergarten class is always, it's a delay to get information to us because we're not in the distribution list yet for Northern. So just to keep that in mind when that email is sent out, to also include the new kids.
Yes, I think your comment was to make sure we heard it clearly, to make sure even those that are entering kindergarten are included in that communication, as you may not be in the system. The system yet.
Yes, correct. Thank you.
don't see any other hands, Mr. Seacrest.
Okay. We will take a brief break here and go into executive session.
So members that are of the community, executive session is not an open meeting. We'll be discussing personnel matters.
Get to look at your smiling faces.
Thank you.
Yeah, sort of. You look much better that way.